Joining us now is WGN Morning News medical contributor and Northwestern Medicine physician, Dr. Lauren Streicher. Thanks for being with us.
Good morning.
Good morning.
So first up, a game-changing weight loss drug. We've heard that before. What's different about this?
This is different. This is really different. The name of the drug is semaglutide, and it's actually not a new drug. It's been around since about 2017 to treat adults with type 2 diabetes. Well, it turns out that if it's given in higher than the usual doses, it's a really effective weight loss drug. So Dr. Bob Kushner, who's like the weight loss expert at Northwestern, he was in charge of this research, and he's calling semaglutide a game changer in the treatment of obesity. So what does it do? Well, it basically tricks the appetite centers in the brain and in the gut into making people feel full, even if they've had very little to eat. And to your point, Robin, unlike other weight loss drugs that we have heard this before, this works so much better. There's 5 weight loss drugs on the market right now. And this one not only works dramatically better than the other weight loss drugs, but it has less side effects. So let me touch on the study for a little bit, because it was big. There were 2,000 people in this study, and they all got the usual counseling about diet and exercise and all of that. Half of them got the drug, half of them got the placebo. So the people that did not get the drug, and they took it for this was over a year study, the people that didn't get the drug, they only lost 2.4% of their body weight. The people that got the drug, 15 to 20% of their body weight. I mean, that's huge. No other weight loss drug has done that. And we're talking for some of these folks, 40, 50 pounds without any real side effects. So this is a game changer. This is big.
All right, and using contraception and then the return of normal fertility. What does the study show?
So this is interesting, because this is a question I get all the time. Obviously when women are using birth controls because they don't want to get pregnant, but for then women who go off because they do want to get pregnant, how long is it going to take? And no one's really looked at this. So this, again, huge study, 18,000 women, and they compared different kinds of contraception. So what did they find? Well, the worst was women who were using injectables like Depo-Provera. It took sometimes up to 8 months for them to get their periods back, to get fertility back. The patch was next up, like 4 months, so still a pretty long time. IUDs, whether it was a copper or a progesterone IUD, pretty good. Only about 2 months. So it seems that the best method of birth control to use, not only to prevent pregnancy, is an IUD, because it works the best, but also the one that's going to give you your fertility back the quickest when you do want to get pregnant. But there's a caveat that's really important here. This doesn't mean that you're protected. Some people got pregnant right away. So if you don't want to get pregnant when you go off your birth control, no matter what kind you were using, you still have to use some kind of protection. And the other thing that they really looked at is, what about these people who've been on the pill a long time? I mean, I have patients all the time who tell me, I'm so worried, I've been on the pill for 15 years. Am I going to be able to get pregnant when I get off? And the answer to that question, according to this study, is, yeah, they might have trouble, and it's because they're older, but it's not the birth control that made them, have less fertility.
And speaking of oral contraception, a link to decreases in cancer.
Yeah, a lot of people are concerned that if they're on taking hormonal birth control, that it might actually increase their risk of cancer. And this is actually not news. We've known for a long time that it doesn't, that there's a decrease in ovarian and uterine cancer for women who's been taking birth control pills. But what this new study looked at was, how about women that took birth control pills a long time ago? Because the pill's now been around for 50, 60 years. So that means we have a whole group of women who are now in their 60s and 70s, which is the time when you're going to see an increase of cancers like uterine and ovarian cancer. And they wanted to know, well, what about those women that took pills 30 years ago? Are they still getting protected? Are they at higher risk or lower risk? And this is good news. This is really good news. What we're seeing is that it is still protective. 30 years later, women that took the pill have less ovarian and uterine cancer than women who did not take the pill. The other thing they looked at was breast cancer, because everyone, of course, worries about that too. And there's been a lot of conflicting studies. Does the pill increase breast cancer, doesn't it? And in this study, which was 250,000 women, by the way, so this was a huge study, they found that 30 years after taking the pill, there was no difference in breast cancer in women who took the pill and who did not take the pill. So this is good news, very reassuring.
All right, and new tobacco cessation guidelines.
All right. 68% of smokers say they want to quit, but only 7% of smokers are able to successfully quit in a given year. So there's this huge disconnect between wanting to quit and being able to quit. So the U.S. Preventative Services Task Force really looked at this and recently came out with some new recommendations. And there's 3 major points that they made that are important for people that want to quit. Number 1, they found that the intervention that worked better than anything else was when someone actually talked to a doctor or another healthcare professional about wanting to quit and got a drug to help them along the way, whether it was varenicline or Wellbutrin. The drug and the counseling together help. But this is number 2. You have to start the medication before your quit date. If you say my quit date's a month from now, you start the medication now, not on the date you want to quit. And number 3 that this task force came out saying was that e-cigarettes, they're saying, while some data shows it might help, they're saying it is not the way to go. Go with the counseling with the healthcare professional and a drug, and you have the greatest likelihood that you're actually going to be successful in quitting smoking.
Real quick, reiterate the name of that weight loss drug you said is so good. People are already emailing me.
Yeah, the name is semaglutide.
Semaglutide.
And it is available because it's been out. It is a prescription drug. It is something you need to inject once a week, self-inject, and it's covered by insurance for diabetes. It remains to be seen if they're going to cover it for weight loss. They should, clearly. I mean, it'd be crazy not to, but that remains to be seen.
All right, Dr. Streicher, thanks again. You can follow her on Instagram or Twitter or go to drstreicher.com. Thanks again.